Let's talk about shockwave therapy to really heal tissues. So it was originally designed in the 1980s to help heal kidney stones and break them up. But they realized with patients that it was helping to heal other issues and other ailments and helping to heal other tissues in the area that they were treating the kidney stones with. And so over the decades, we've really researched this and developed it where we can use it in a clinic setting now to help heal acute as well as chronic tissue injuries, whether it be bone pain, joint pain, and soft tissue injuries. So when we say shockwave therapy, there's actually no shocking involved. It's really a terrible name in my opinion. But when I tell patients there's no shocking, instead it's a wave of energy that's being generated to the cell to help heal it at a cellular level to really promote healing. So the healing effects are wonderful, where it decreases pain, which is obviously super important, but it also helps to improve the energy and the circulation to the area by bringing more blood flow to the area. If you can bring more blood flow, then it can heal better. It also decreases the inflammation in the area, and that's a pain generator. As well, it more importantly is stimulating what we call stem cells. We have stem cells everywhere in our body, and when you can stimulate stem cell production, the stem cells can then generate new tissue cells, new ligaments, new muscles, new tendons, help to break down scar tissue. So as you regenerate the tissues, you're really healing the tissue. At the end of the day, it's really healing. So we're stimulating metabolism, more blood flow, regenerate. It's amazing. It is completely non-invasive, and there are no side effects to this treatment, which is lovely for patients. We're accelerating the healing time, and at the end of the day, it's really quick. Most treatments will last within 10 minutes. We're treating a body, an area of the body that the patient's having an issue with, and that makes it very affordable because it's really quick. So there are many, many studies out there, and if we look at the overall trend, there are many randomized controlled trials, and for the different ailments, the different conditions, on average 75 to 95% of patients will report a significant improvement from pain and improved overall function. The list is really long, so you might see one of your issues here and it might not be there as well, but let me go through some of this. So if you're experiencing shoulder pain from either a rotator cuff issue or some kind of shoulder rotator cuff tear or a tendinopathy, anything with an opathy and itis means the tendon is inflamed, whether it be an acute or chronic issue. That can help heal that tissue and help break the chronic cycle if it is a chronic issue. I've got frozen shoulder there, so that's a really tough issue to have, and shockwave therapy, the studies show it, and clinically we see great changes for patients. Plantar fasciitis, also known as heel pain, responds very well to this type of therapy, as well as Achilles tendinopathy, so pain at the bottom of the lower leg. When you have chronic knots or trigger points, I have many patients who responded really well to that. It can also help break down scar tissue. So whether it be scar tissue from injury or scar tissue from a surgery, that can help make scar tissue more pliable and help it to flex and contract and expand better. Tennis elbow or golfer's elbow, that responds very well. Jumper's knee is basically tendinopathy of the patellar tendon, so right in front of the knee. Rotator cuff tendinopathy, we have fascial release. So anything where there's constriction of what we call the fascia, which is the outer laying of tissue. If it's too tight or constricted or has scar tissue, it won't move and bend, and the mobility of that area won't be as efficient as it can be, so it helps to break that down. I've also used this for shin splints, so whether it be athletes or someone who has overdone it or a new activity, really it helps to decrease pain. So at the end of the day, if you have an acute or chronic issue and it's somewhere in the physical body, whether it be your neck, your elbow, your knee, anything is almost able to be treated with shockwave therapy. You just want to check in with us to see if it's something that we can help you with. But at the end of the day, it's really, really helpful for many problems and conditions. It's really worth giving it a try if you're having some struggles with a problem that hasn't healed yet, or an acute injury. It just accelerates the healing. So you might be asking yourself, how many treatments might I need? And it really depends on what we're treating, how long you've had it. But I'll always tell patients at a minimum, we're doing, in most cases, 4 treatments. Some might need 6 to 10, depending on if it's, again, a chronic, if you've had it for a really long time. But I will say that most patients start to feel a change within that first 4. And if not, then we need to maybe look at something else. But it's, I'm always, it's always fascinating to see how quickly patients respond with shockwave therapy. You might be saying, how often do I need to come? And again, that depends on the issue, the diagnosis of the area that we're treating. But I will say on average, most will come 1 to 2 times per week. Are there restrictions after treatments? The quick answer is no. However, there might be some home care that I will recommend to you, whether it be home stretches, home exercises, and icing. There might be some restrictions where maybe you'll need to get, let's say if we're treating your shoulder, I might say, let's not work out that shoulder until it's healed, not until it necessarily feels better, because at the beginning people feel better and they want to get back to their activities right away, but it's not uncommon that we might need to strengthen that area. But it really is case by case for that person. Will it hurt? And the answer is no. You will feel the shock wave, so you will feel a mild sensitivity in the area that we're treating, but the intensity can always be changed, increase it and decrease it based on the patient's sensitivity. Many patients will feel an improvement right away, and the best part about shockwave therapy is not only that it works, but it's really quick. It's not a very long treatment. Like I said, you'll treat an area within 5 to 10 minutes, depending on the area that we're treating, and it's really efficient. So at this point, if you're wondering if we can help you, reach out to the office and we'll help you get started to do a proper assessment to see what we're treating, and we'll go from there.